The newsday continues here on One News Now. I'm Riza Diaz. The government is aiming to vaccinate 15 million Filipinos by the end of 2021. To achieve this, NTF Deputy Chief Implementer Vince Dizon told One News the chiefs that the government plans to inoculate around 300,000 people daily. However, they must hurdle one problem: vaccine supply.
Given the unpredictability of supply, we really need to ensure that those that we inoculate will have a sure second dose. So we are just going to, we've already deployed 300,000.
Due to the recent spike in cases, Dizon said that the IATF will revisit some of its protocols. He added that they will reconsider plans to reopen cinemas as well as other past decisions of the IATF before the recent surge in cases.
We are looking very closely at reconsidering some of the past decisions that have been made prior to the increase in cases. Clearly, we must look into that. And then the IATF will be meeting very soon and get advice from the experts in order to move forward.
With the arrival of vaccines, more and more healthcare workers are being vaccinated. Symbolic vaccinations have also been held across the metro. How have these affected the confidence of frontline workers in vaccines? JC Cosico with the details.
On this day last year, the first local COVID-19 transmission, patient number 5, was admitted to Cardinal Santos Medical Center in San Juan. A year later, CSMC has vaccinated its medical staff with Sinovac Coronavac. At least 1,000 of their workers are willing to receive the China-made vaccines. Among the first recipients, patient number 5's attending pulmonologist, Nino Hill O'Connor. O'Connor recounts that unforgettable March 5.
Nag-quarantine ako yung day na yon kasi exposed kami. But I always wear mask naman during that time.
He has managed to remain negative for COVID-19 to this day, but he wished the vaccines have been developed sooner to prevent some deaths.
Sana lang talaga, kaya lang talagang ganun. It took time talaga to create this vaccine.
The De Los Santos Medical Center in Quezon City has also given Sinovac shots to some 300 health workers.
Nowadays, people shy away from going to the hospital because they're scared. But if the people here are well protected, chances of spreading amongst us and to our patient is less likely.
The Private Hospitals Association of the Philippines says 70% of employees earlier consented to getting vaccines. More than half backed out upon learning that it would be Coronavac. But once rollouts began, PHAP observed that more workers were convinced to get the Chinese jab.
Most of them are waiting for the AstraZeneca. But some still believes na okay na yung Sinovac.
PHAP reports a decline in moderate and severe cases, with bed occupancy currently at 30 to 40%. It urges all medical frontliners to have themselves vaccinated as soon as possible. For News 5, JC Cosico, we are One News.
Taking one's time in choosing vaccine is, quote, immoral. That's according to NITAG member Dr. Maria Consorcia Lim Quizon. She says the principle that must be followed is to roll out whatever vaccine is available, and that the only reason there seemingly is a choice is because the first vaccine that arrived in the country cannot be used by senior citizens. She adds that being over-particular with regard to vaccines may lead to belated vaccination of all or most of the general public.
Every day na nagdidilid-dali tayo na nandyan na yung bakuna is so, for me, is immoral. You know, it can save lives, so i-roll out mo na yan. The scarcity of resources, and we have to make do. We have to think not only of ourselves, but of the general public.
Dr. Lim Quizon also urges the public to follow minimum health protocols to prevent being a casualty of COVID, which she tags as World War C. She compared the Philippines' response to that of Taiwan, saying that wearing of masks helped greatly in preventing COVID-19 infections abroad.
So we keep on repeating na, guys, even if there's this vaccine already, you know, nothing can replace yung talagang pag-iingat natin. And this spike of cases will tell us na, tingnan mo, pag nagpabaya ka, kung ano mangyayari. If we can say talaga na siguradong I've exercised everything that as good as can be, then we're safe.
An infectious disease expert is urging individuals experiencing COVID-19 symptoms to consult with doctors to stop further infections. In an interview with One News The Big Story, Dr. Anna Ong Lim calls on the public to immediately seek checkups upon following flu-like symptoms to prevent the further spread of the virus. She also warns that contact tracing will be harder if a symptomatic person refuses to get tested as soon as possible.
As individuals, once again, no, if we start feeling symptoms, let's not let time pass by too long before consult. And if we are in an area where there's active transmission of cases, then do please consider being tested right away.
The World Health Organization warns countries against relaxing pandemic measures even during vaccine rollouts. In a news conference yesterday, the organization cited the possibility that the epidemic in Brazil might spread to other countries. Dr. Mike Ryan, a WHO expert, warns countries may weave between back-to-back surges if we drop our guards.
The arrival of vaccine is a moment of great hope, but it potentially also is a moment where we lose concentration. You don't need a whole lot of people to start thinking like that we give the virus opportunities to spread. And countries are going to lurch back into third and fourth surges if we're not careful.
Meanwhile, WHO Director General Tedros Ghebreyesus compared the pandemic to the Second World War, saying the COVID pandemic is much worse and may affect the world for many years to come.
This COVID pandemics with bigger magnitude, more lives have been affected. Almost the whole world is affected. And that means mass trauma, which is beyond proportion, even bigger than what the world experienced after the Second World War. And when there is mass trauma, it affects communities for many years to come.
We'll be back with more stories after the break. Keep it here on One News. You're still watching One News Now. I'm Riza Diaz. Inflation climbed to a two-year high of 4.7% in February, driven by higher pork prices. Del De Vera with the story.
Malu, a vendor from Quezon City, can barely get her family a day's worth of decent meals with a 200 peso daily budget. She says it is even harder to earn money for her family of 6 in this pandemic.
Pinagkakasya ko lang yung 200 ko sa loob ng isang araw. Sobrang hirap talaga po ngayon kagawa ng sa pandemic.
February inflation hit 4.7%, the highest since January 2019. Economist Nicholas Mapa attributes this to the problem in pork supply. He says importing supply is only a short-term solution for the hog industry.
The key issue here is kung ma-address ng authorities yung supply side issues, diba? So kung pinabayaan nila yung African swine fever problem, baka tuloy-tuloy talaga yung increase.
But as provinces send pork to the metro to address the gap, meat prices outside NCR picked up to 20.8%, while its prices in NCR slowed down to 20.4%. Economist Professor Emmanuel Leco tells Business World Live this might also be due to a shift to other alternatives.
In terms of how the numbers showed up in the National Capital Region. I think the shift to other alternatives other than pork was more swift than in other provinces, in other areas. So before it was a pork-focused diet, I guess NCR residents shifted to something like fish.
With inflation accelerating for 5 straight months, purchasing power has weakened as well. But MAPAD does not advise the public to cut spending, as it will slow down or even stall economic activities. Presidential Advisor Joey Concepcion suggests a gradual easing of curbs to rev up consumer spending. He is also for the relaxation of age restrictions to allow more economic activity.
If you were to choose two, what would spur economic activity? Definitely is to relax the age, and Secretary Mon Lopez even supports that, and the economic team.
Malacanang says the president wants to see 2 million Filipinos inoculated first before lifting quarantine statuses in various parts of the country. For News 5, Dale De Vera, we're One News.
Now, it's not just pork that is seeing an increase in prices, but also galunggong. Despite being touted as a poor man's fish, galunggong prices rose to 300 pesos per kilo from previous 200 pesos per kilo. Fish vendors attribute the increase to changes in water temperature affecting the volume of catch, while others say it's just because of the pandemic. Cabinet Secretary Carlo Nograles said they are closely monitoring the prices of fish products to determine if a price cap is necessary.
I-monitor po natin itong mga presyo hindi lamang ng galunggong pati yung ibang mga presyo ng pagkain po natin. And we will await kung ano yung magiging hakbang or ano yung magiging action points ng Department of Agriculture tungkol po dito.
And those are the top stories of the hour. Join us later at 12 noon as we continue to monitor the day's biggest stories. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. I'm Riza Diaz. We are One News.